As the COVID-19 crisis has exploded in India in recent weeks, the Twitter account of the Press Club of India has refashioned itself into an ad hoc publisher of obituaries for members of the profession. The world has been increasingly watching in horror as something akin to a humanitarian crisis unfolds in the country, where the numbers of cases, hospitalizations, and deaths from the coronavirus mount at a staggering rate. The current surge in India has pushed the country's number of total cases since the pandemic began to more than 19.5 million as of the time of this writing, second only to the US, per researchers at Johns Hopkins University. More than 215,000 have died there, and the country is adding on average more than 3,000 COVID-19 deaths every day, though the presumption is that those totals vastly undercount the true reality. As if all this wasn't bad enough, not even 2% of India's adult population of 940 million has been fully vaccinated, according to the Our World in Data project at the University of Oxford. Every other day, we hear news of a member's passing. Amrita Madhukalya, a member of the Press Club's managing committee, told me. As part of the Twitter team, we know that the digital communication is important, especially since the club is closed. Delhi is under lockdown right now. As soon as we get to hear of someone's passing, we try and source details of their lives and then their pictures. In most cases, colleagues always come forward to help. The point is that we do not miss key details, and we do not get it wrong. The club itself has more than 4,000 members journalists, and it is not uncommon to have days when the club tweets out multiple messages of condolence in memory of journalists who've died from COVID-19. It is gutting to see young lives go away in the blink of an eye. There are members who leave behind young kids. A popular member was 41, and he leaves behind 2 young daughters. Another member, who was a key member of the club's managing committee over the years, left yesterday. He followed his wife, who had passed a day earlier. The couple leave behind a daughter. While the surge there is being fueled partly by the spread of more virulent strains of COVID-19, India's journalists told me that what's happening right now is the result of a perfect storm of tragedy and self-inflicted errors. It's a combination of low vaccination rates, hospitals running low on key supplies like oxygen, and wide swaths of the populace not being put under lockdown until it's been too late, even as mass political rallies and unmasked political leaders have sent a message that a crisis is not at hand. Dinakar Perry, a defense correspondent with the daily newspaper The Hindu, told me that the problem has been compounded by the supply of things like hospital beds, oxygen, ICU space, and life-saving therapeutics running dry.